There's our exam. Our assessment of otitis media shows that we gave the amoxil, and then all the counseling plan that was part of the macro. The follow-up is in there. Attending notes in there. This note's ready to save. So we bill the visit, E&M billing. Based on what we put in there, it's a level 3. We were probably pretty close to a level 4. It may have actually been a level 4 if you keep in mind that I typed in the freeform, the HPI in the freeform field, which means that it doesn't count towards the computer's automated level of service generator. If I had used the trees for the HPI, this might bill out to a 4. So I'd have to consider that. But for now, we'll just bill the visit at a 3, with that being what it came up. I like when I pull up this unwieldy list here, the first thing I always do is hit an R because it's the first letter of Roden. I don't have to scroll so far. And there is Dr. Alexander's name. I can, when it's highlighted like that, I can click it, or I can just hit Tab, and it'll go to the next field, and the one that we just came off of will be, we'll have selected whatever it was on right before I hit Tab. So we're ready to save this. And now we're ready to save the document. Click Save Document, select E&M Family Medicine, and then we'll select Dr. Alexander's name so that it'll send her a message saying that she needs to sign the chart. Then I will sign the note. This is my last chance to make any changes if I want to. If I do want to make changes, I can click the Enlarge button and go down and make changes wherever I wanted to make them. Then click Save to Chart. Then I click Sign. I enter in my signature code, and it'll say there, document is signed by Roden John. Okay, now in another lesson, we'll talk about how to do a visit that it's very useful to use the trees for the history and the exam, but that's it for this visit. Okay, in this section, we're going to go through another vignette, this time with a patient with some chronic problems, and we're going to see just how well the EMR can function to save us time when we're doing a note on a patient who's in every 3 months with the same issues, and we basically take the same history every time in the exam room. We do the same exam, do a lot of the same things. So in this particular case, we have a fake patient, Martha Mouse, 53 years old, has hypertension, diabetes, and hyperlipidemia. And let's just say that in our visit, everything was controlled, and all we did was refill her medicines, and we're going to order her labs. And we'll go through and do all those things at once and generate the note as we're doing it. So let's go to physician office note adult, and we'll choose any one of her 3 problems. I'll choose hypertension. Keep in mind that this patient would be someone who I have seen on a regular basis in the past, and her information is going to be in the trees because that's where I've entered it in the past. So let's go to history. Again, I always do my attending note in the history just to get it out of the way. Now let's just go to history of present illness. This is where I've entered it in the past. Say she was here 3 months ago, and so all I have to do is click last visit. All this stuff is the same in this visit, so I don't have to type in anything with regards to her hypertension. Now, for her diabetes and her hyperlipidemia, those trees, now that I'm inside the hypertension tree, are going to be found under other, and so we can go to dyslipidemia. Again, last visit, let's say all this stuff is still the same, and diabetes, last visit, let's say that lately he's been checking it only once a day. Make a quick change. Just change whatever. The point is to change whatever needs to be changed, but most of the stuff on these type patients is going to be the same every visit. So you have the benefit of clicking last visit. And now you can see, I'll just pause what we're doing here and show you. We've got the entire HPI for all 3 problems filled into our note for us. No typing necessary. Now let's say we want to include family and social history and review of systems in this note. Again, If it's already in there, all you have to do is click on it to make it show up in the note here. Obviously, father MI at 60 is pertinent to this type visit. Social history is important to click on this type patient to include in the note, especially whether they smoke and drink alcohol. It's already in there. So we're just kind of clicking through this patient's chart and populating our note without having to really do any real work. And on review of systems, on this type patient, I always do essentially the same review of systems each time. Find out if they're feeling well overall, and cardiovascular and endocrine are already part of the HPI. Endocrine being counted as the diabetes and lipid disorders. So now we've got an HPI, a review of systems, past medical history, a social history, a family history, all populated in the note, and we haven't really hardly typed a single thing. So we're done with the history, and we probably have a level 4's worth of history put in there. Exam, again, on this type patient, I pretty much do the same exam every time. Just click last visit. If all this stuff is the same as last time, great. And if it's anything's different, you can just change that one thing. Under assessment, let's go in. Let's say all three things are controlled at this time. We always have that long-term use medication diagnosis on people who have issues like if they're on a statin, so that we can get the CMP. That's a diagnosis that'll pay for a statin. So let's just say that we're, I don't know, let's say that their hypertension is uncontrolled, that their blood pressure reading was high today, and so let's say the diagnosis, the diabetes is controlled, and hyperlipidemia is controlled, and long-term use of medication. I need to activate that diagnosis so that I can order something using the diagnosis, and by default it's listed as not treated, so I'm going to change it to unchanged just to make the diagnosis active, so that when I get into the ordering program I can actually use that diagnosis to order the CMP that I'm going to want, since she's on a statin. So now I've updated all my diagnoses, and you'll see that now my note is populated with all the history stuff that I looked at and clicked on, the entire exam that I clicked on, and then all the assessment will be the issues that I've now updated on the diagnosis list. So we just need a plan. Part of that plan will be the prescriptions, and let's say the glucophage and the Zocor, we're just going to refill the same way they were last time. So we're not changing those. Let's see how many refills we gave them last time. 5 refills. I'm going to give them 5 refills again because they're stable, so I can just click same refill on both of them, and they're once again refilled with 5 refills of unchanged. Say the blood pressure was high today, and we decided that we would bump that lisinopril up to 20. And we'll give her just 1 refill because we want to have her come back pretty soon so that we can make sure there's no problems with the lisinopril at the higher dose, make sure it's working, and we'll just go ahead and stop that 10 and say change in dose. And at this point we'd print the script to give to the patient. Go into plan, and our plan really is going to be that prescription, the follow-up in a month or two to recheck the blood pressure, and whatever labs we order. So let's open up the ordering program here. And actually it's going to recommend a lot of stuff for me: the hemoglobin A1C, the lipid panel, diabetes foot care, all this stuff. I'm just going to go ahead and accept, but we're going to add a few things. Remember, these top picks are helpful. I like to use the top picks. They're based on each diagnosis. As you change the diagnoses, the top picks will change. CMP for that long-term use of medication. For the hypertension, let's get a TSH. We already have a metabolic panel. Get an EKG. And for the diabetes, we've already got the A1C.